This is a 32-year-old female with chronic migraine headaches. Arising from the left anterior clinoid process, there is a round, solid, T1 hypointense, T2 FLAIR mildly hyperintense, enhancing, extra-axial, dural-based mass compatible with a meningioma. The lesion extends towards the Sylvian fissure on the left, with abutment and partial encasement of the left ICA supraclinoid terminus, proximal M1 segment of the left MCA, and proximal A1 segment of the left ACA. The lesion abuts the proximal-most aspect of the infundibulum on the left. There is also contact and deformity of the left lateral aspect of the optic chiasm. There was no invasion of the left cavernous sinus or Meckel's cave region. Meningiomas are the most common extra-axial masses of the central nervous system. They are typically benign, and complete surgical resection is usually curative. Meningiomas are up to 2 times more common in females. They can be seen in the setting of NF2. Typical clinical symptoms include headache, paresis, focal neurologic deficit, and altered mental status.